Asthma is a chronic condition that causes the airways in your lungs to swell and produce a thick mucus, which narrows the airways, making it hard to breathe. It can also cause coughing, wheezing, and shortness of breath. The severity of asthma can be different from one case to the next, so for some people it can just be an annoyance, but for other people, their everyday activities could lead to an asthma attack, which in some cases could be life-threatening. Since asthma is a chronic condition, there is no cure, but with proper treatment, the symptoms can be managed.
Asthma is a condition that affects the respiratory system and can make it difficult for an individual to breathe normally. To understand how it works, it's important to have a basic knowledge of how our lungs work. When we inhale, air moves through our airways from our nose or mouth down a large hollow tube in the front of our neck called the trachea and brings the oxygen-rich air into our lungs as seen in the first diagram. This occurs as the diaphragm moves down and our chest expands, pulling the air in. The trachea divides into two tubes called the bronchial tubes, or bronchi, in the lungs. As these tubes pass through the lungs, they continue to divide into smaller air passages called bronchioles. Tiny air sacs that fill with air each time we inhale, called alveoli, are found at the end of each bronchiole. At the alveoli, oxygen moves to the blood in our capillaries, and carbon dioxide moves from the blood in our capillaries to the air in the alveoli, a process known as systemic gas exchange, as seen in Figure 2. When we exhale, our diaphragm moves upward and thus pushes carbon dioxide-rich air out back through the path it originally came in using and eventually through the trachea, allowing it to exit our bodies to the surrounding environment. Asthma particularly affects the bronchi and bronchioles. These tube-like airways have an inner lining called the mucosa and is surrounded by a layer of smooth muscle. Normally, the mucosa thinly lines the walls of the airways, and the airways are open and easily allow airflow to pass through. In individuals with asthma, however, the airways are chronically inflamed, as seen in the diagram. As a result, these individuals are hyperresponsive to various triggers such as tobacco smoke, pollen, exercise, stress, and more. Once exposed to a trigger, people with asthma can experience an asthma attack. When exposed to a trigger, the smooth rings of muscle that circle the small airways of the lungs contract and become narrower. The trigger simultaneously worsens inflammation, causing the mucosal lining to become more swollen and increase the amount of mucus secreted. Normally, the body uses this thin mucosal lining to trap particles such as pollen or dust. During an asthma attack, however, the mucus builds up and blocks the already narrowed airways, making it increasingly difficult to breathe. The smooth muscle constriction results in a feeling of having a tight chest, while excess mucus and increased inflammation can result in coughing. As the airways constrict and air attempts to pass through the narrow passageway, a wheezing sound can occur. All such symptoms can result in the individual feeling like they're running out of air. More so, the inflammation can make it harder to exhale than inhale, meaning more air is entering the lungs than it is exiting. Over time, this can lead to an excess of air in the lungs, known as hyperinflation. This trapping of air forces the body to work harder to breathe, which can lead to reduced oxygen delivery in the body's organs and tissues over time. This can be fatal if left untreated during severe asthma attacks. As mentioned previously, systemic gas exchange allows oxygen to enter the blood and carbon dioxide to exit the blood as an individual breathes. This exchange also impacts blood pH levels, as carbon dioxide influences blood pH by reacting with water to form carbonic acid, which can dissociate to form a hydrogen ion and a hydrogen carbonate ion. Therefore, an increase in carbon dioxide in the blood results in more hydrogen ions and a lower, more acidic pH level in the blood. Normally, the body maintains a stable rhythm of inhalation and exhalation that allows for the proper amount of oxygen to enter and carbon dioxide to exit the lungs, thus maintaining a proper blood pH homeostasis. However, during an asthma attack, since it is more difficult for air to exit the lungs than it is for air to enter the lungs, the carbon dioxide-rich air that needs to exit the body is trapped inside the lungs, causing the concentration of carbon dioxide to surpass the necessary amount for homeostasis. More carbon dioxide available to react with water and form carbonic acid will increase the amount of hydrogen ions in the blood. This can lead to respiratory acidosis. Respiratory acidosis occurs when the lungs can't remove enough carbon dioxide that the body produces, such as during an asthma attack, which causes the pH of the individual's blood and other bodily fluids to decrease and become too acidic, causing a variety of possibly damaging symptoms that can be associated with asthma attacks.
The number of triggers is specific to each patient. For most asthma patients, the number of triggers is relatively low and easily manageable with proper treatment and precaution. Patients can have a large number of asthma attack triggers depending on allergies and sensitivity of the bronchioles. The most common triggers for asthma attacks are smoke, air pollution, pet hair, mold, cleaning and disinfectants, and physical exercise. Some asthma patients develop uncommon triggers like thunderstorms and cold air, certain foods and food additives, aspirin, and acid reflux. Thunderstorms cause asthma attacks by grass pollen grains being drawn up into the clouds as the storm forms. The pollen grains absorb water and then burst open, spreading pollen allergens throughout the wind and rain. Cold air causes the lungs to constrict and dries the airways, causing them to spasm and trigger the attack. Studies have found that sodium bisulfate, potassium bisulfate, sodium metabisulfate, and sodium sulfite are potential triggers for asthma attacks. According to the American College of Allergy, Asthma, and Immunology, about 20% of adults with asthma are sensitive to and have symptoms of asthma attacks after taking aspirin, ibuprofen, and naproxen. According to the ACAAI, acid reflux can irritate and cause a hyperreaction in a person's airways, triggering an asthma attack.
Although it's unknown exactly what causes asthma, health experts believe that there are a few factors that can increase the chances of developing the condition. The first one is genetics. If you have a blood relative or family member with asthma, it can greatly increase your risk of developing it yourself. Next is gender and age. Asthma is more common in children, and most children who have asthma usually develop the condition before the age of 5. Boys are more likely to develop asthma over girls at a young age, but in adulthood, it is more commonly found that women develop the condition over men. Another early on factor that can lead to developing asthma is having a viral respiratory infection at a young age. This infection can cause changes to a developing immune system, which in some cases can lead to the development of asthma. The next risk factor is sensitivity to allergens. The more allergies that one has puts them at a greater risk of developing asthma. These allergies include things like dust mites, mold, pet dander, food, pollen, and more. Sensitivity to these allergies can also increase the risk of an asthma attack in someone who has already been diagnosed. Being overweight increases the risk as a child or adult, as well as the exposure to cigarette smoke. Smoking cigarettes or someone who is often around secondhand smoke causes irritation to the lungs, which could lead to asthma. Certain job-related exposures to pollution and chemicals can greatly increase the risk of developing asthma as well. Some of the occupations that frequently expose someone to these chemicals and pollution include drug and detergent manufacturers, farmers, hairdressers, and plastic and metal workers.
For these symptoms of asthma, shortness of breath is one of the more common symptoms, as well as rapid breathing. Chest tightness is another symptom, which also can be chest pressure or chest pain. And with wheezing, a patient can experience wheezing or coughing post-exercise or post-physical activity, but it doesn't have to be due to exercise. And trouble sleeping can be another common symptom due to nighttime asthma attacks or asthma episodes, depending on the severity of the patient. And finally, racing or increased heart rate can be a symptom due to shortness of breath and rapid breathing. To continue a little bit further into the symptoms of asthma, a patient may have different severities and persistence levels of asthma, and this can affect what type of treatment a person may get, but we'll talk about that later on. To begin, mild intermittent asthma is when a patient has mild symptoms that may occur once or twice a week during the day and maybe once or twice a month during the night. Mild persistent asthma is still mild symptoms, but they are occurring a few times weekly, but not more than once a day. Moderate persistent asthma is when a patient complains of symptoms daily and possibly more than one night a week.
Finally, severe persistent asthma is when symptoms are occurring multiple times a day and frequently throughout the night.
For the treatment of asthma, as mentioned in the previous slide, a patient's treatment depends on the level of severity of their case. Most times, a patient is treated through medication. There are long-term medications, quick relief medications, and if a patient has allergies that cause their asthma to be worse, sometimes an allergy medication can be beneficial. Another option besides medication would be bronchial thermoplasty, which is used when a patient does not feel any improvement through inhaled corticosteroids or any other long-term asthma medications. Bronchial thermoplasty is when a doctor heats the insides of the airways within the lungs with an electrode which reduces the smooth muscle within the airways and limits the ability for the airways to tighten, which makes it easier to breathe for the patient. As far as long-term medications, inhaled corticosteroids are steroids that can be inhaled nasally and have a very low risk of serious side effects, which makes them very beneficial. Another medication is leukotriene modifiers, which are oral medications that can be taken. These do sometimes have possible psychological effects as a side effect, which can make them a little bit risky to take. Combination inhalers are long-acting beta agonists along with a corticosteroid inside of the inhaler. And theophylline is an oral pill that helps keep airways open by relaxing muscles around the airways. This is not a very common medication compared to some of the other long-term medications. For a quick relief medication, short-acting beta agonists are very common. These are also known as inhalers. Anticholinergic agents are used to immediately relax airways, making it easier to breathe in the moment for the patient. This is normally used with bronchitis, but it can be used with asthma. Finally, oral and IV corticosteroids can be prescribed. An example of this would be prednisone, and this allows inflammation within the airway to be relieved. However, these corticosteroids can cause serious side effects, so they are normally used only in a short period of time to relieve severe asthma symptoms. As mentioned earlier, if a patient does have allergies that causes their asthma to become worsened, allergy medications such as allergy shots or biologics would be beneficial to someone's asthma as a treatment.
During diagnosis for asthma, doctors will start with a physical examination to rule out other possible conditions like a respiratory infection or chronic obstructive pulmonary disease, as well as ask questions about signs and symptoms the patient is having. Doctors will also ask about family history and any other health problems the patient is having. If the physical examination shows nothing, doctors will give patients lung function tests. The first test is the spirometry test. In the spirometry test, patients are asked to take a deep breath and exhale as fast as possible through the device shown in the picture on the left. This test estimates the narrowing of the bronchial tubes to see if the patient is exhaling normally. The next test is the peak flow test, shown in the picture on the right, which measures how hard a person can exhale. Lower peak flow readings can indicate asthma or the worsening of asthma. Additional testing may also be required. The first test is the methacholine test. Methacholine is a known asthma trigger, and when inhaled will cause the airways to narrow slightly, causing an asthma attack. If a patient reacts to the methacholine, this is a sign that they have asthma. X-ray imaging can be used to identify structural abnormalities that could be aggravating breathing. Sputum eosinophils testing looks for certain white blood cells called eosinophils in the mixture of a person's mucus and saliva, which is called sputum. Eosinophils are a sign of asthma. In cold and exercise-induced asthma testing, doctors measure airway obstruction before and after exercise or after taking several breaths of cold air. After testing, doctors will classify the severity as shown in the bottom picture. A large majority of patients have good control over their asthma, and the general prognosis for asthma patients is very good. Patients who develop asthma later in life have a poorer prognosis than those who develop it at an early age. Patients can improve their prognosis and life expectancy by taking care and proper medication to reduce the severity and frequency of asthma attacks. Smoking can greatly reduce the prognosis and life expectancy of asthma patients.